Hello, welcome to ANA community. In this particular video, we are discussing about pulse rate, which is one of the essential component of a dental examination. When you speak about pulse rate, it is considered to be the general examination finding coming under the heading of a cardiovascular system examination. But to analyze the overall uh, health status, this is being done before doing the systemic examination. Here, only the rate is being analyzed, whereas in case of the systemic general examination of cardiovascular system, we are going to look into the rhythm, volume, and equality of the pulsations, radiofemoral delay, etc., that are being analyzed in general examination of pulse rate in case of a cardiovascular system examination. Here only the rate is being preferred. Normally, the heart rate is equal to pulse rate, or pulse rate is equal to heart rate. Pulse is counted after making resting the patient for a while to ensure that the complete relaxation of the person. Radial pulse is being preferred while doing the pulse rate assessment, keeping the hand in the prone in this way and a little bit semi-flexed position also. In this way, if you are doing that, then the radial pulse will be very prominently palpated. And pulse rate is being recorded in dash numbers of beats per minute. Normal pulse rate varies from 60 beats to 100 beats per minute. In the sense, the heart rate will also be there in the same fashion, that is 60 beats to 100 beats per minute. Normally, this whatever these the pulsations are generated in the heart, that will be transmitted even to the radial pulse. Only in case of the abnormal conditions, this will not be there. As far as the pulse rate less than 60 is being termed as bradycardia. This is being seen in enteric fever. Enteric fever in the sense that is the typhoid. The conditions of jaundice where there is yellowish discoloration of skin, sclera, and mucosa are being observed. Complete heart blocks where the atrial rate will be 100 beats per minute, whereas the ventricular rate will be 60 or 50 or 40 beats per minute. Increased intracranial tensions, that means the brain tumors, etc., or otherwise where there is the hemorrhage inside the brain has happened, or intracranial hemorrhage, or convalescence period of pneumonia or influenza. Convalescence period in the sense that is the condition where the symptoms are being subsided. In those conditions, there will be bradycardia will be observed. Whereas tachycardia, where it is being defined as the heart rate or pulse rate more than 100 beats per minute. This is being observed in case of fever, thyrotoxicosis, infectious conditions such as septic fever, etc. Dear ANA members, that's all for today. Take-home messages from today's discussion are the normally pulse rate is equal to heart rate. Pulse rate is analyzed after ensuring the complete relaxation of the patient, and it is being written in dash numbers of beats per minute. Less than 60 beats per minute is being termed as bradycardia, and more than 100 beats per minute is being termed as tachycardia. Dear ANA community, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you would like to hear in the coming days? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in next video. Thank you.